This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, perfect. So I'll go ahead and share my screen. My name is Carson Mostert. I'm a PGY3. We have Jacob Pereira, who's my co-resident on as well. I'll do the first half, and then Jacob will go in. And of course, we'll answer any questions at the end. We'll try and go through this. We can get to your questions. I'm originally from South Carolina, did actually my undergrad at Brigham Young University, and then did my medical school at the University of South Carolina in Greenville. So that's me. And then I guess, Jacob, do you want to introduce yourself first, and then we can go in?
Yeah, so I'm Jacob. I'm another one of the third years at Mayo Clinic. I did my undergrad and med school at the University of Missouri in Kansas City and my intern year in St. Louis, where I'm originally from. And now I moved up north and super stoked to be here and chat with you guys tonight.
Yep, sweet. And then I should say my intern year I did down in Georgia as well. So let's go ahead. I'll go ahead and share my screen. I apologize. My house never gets very good internet, and it's rainy today, but here we go. So hopefully I don't break up on you guys. So starting off with, just why Mayo? Why should you consider Mayo? First is, mentioned the open door with world-class colleagues. Obviously, the #1 hospital in the world from the U.S. News and World Report for multiple years. I was on my neurology rotation, and we were going through differential, and I was like, I think copper deficiency is on my differential, and the neurologist was like, who really characterized that, right? And I was like, I don't. Was it you? And he's like, yeah, it was me. And you'll find that fairly frequently at Mayo. You just have these world-renowned experts on different subjects. So it's pretty fun that way. Education is definitely prioritized, and feedback's expected. There's mentoring. That just goes without saying. Wednesday afternoons, our consultants pull our pagers, and they take care of everything, or kind of the upper levels do if need be, if we're on a certain service. And that's our didactic afternoons. And that happens whenever there's didactics, it is protected time. And even when there's not, our consultants are, frequently taking us to the side, showing us how to do things. They're just amazing, and education is #1 here. And then when it comes to residents, and then beyond that, even as the next bullet point shows, the needs of the patient come first. It's kind of the buzz phrase, the catchphrase of Mayo. And it is very true. You'll see it time and time again, where the needs of the patient will always trump whatever the needs of the residents, the physicians, the nurses. You really become ingrained in this culture where it's like, what can we do to help the patients? Which is a great way to train, a great way to learn and live. And then on that, we have a lot of responsibility and accountability. As PGY2 residents, we're given a lot of autonomy to do different things, to experience different things, to make recommendations. And we are trusted. People will follow what you say. And then you have a lot of resources on how to become a good physician, like how to learn to become a good physician. This comes from support staff, research, funding. We have so many librarians that help us. We get quite a large fund for going to different conferences, doing presentations. So it's a great thing. And then finally, the work-life balance. You're able to make the most of your time outside work. I have 3 children, and I'm able to see them. I tuck them in almost every night when I can, and we're able to do fun things on the weekends as well. So there's definitely work-life balance here. Well, also clearly, like we talked about, learning. As far as Mayo Clinic itself, we see a ton of patients from all over the place, patients from all over the world. And then there's St. Mary's Hospital, which has a ton of ORs, level 1 trauma center. And we have our 36-bed inpatient rehab unit. So on your consult service, you'll see someone at every part of the hospital from all the way up to the ICU and offer recommendations. And of course, once we get the rehab unit, we have quite a variety as well as quite, I think, selected patients, patients that you may not see anywhere else in the world because Mayo is so specialized. So, post-cancer, post-transplant patients, and then of course your spinal cord and your traumatic brain injuries and your strokes. Rochester itself is a pretty cool city. 120,000 people, over 200,000 with the suburbs. You have just about everything you could ever want around here. You got pretty good restaurants, lots of parks, things to do. You got your minor league teams, and then also you got the Twin Cities up north, which aren't too far away if you're craving something a little bigger. But as we were just talking to someone, there's a Trader Joe's and there's a Costco for those people that like those. So you got pretty much everything you could need. As far as the residency itself, we got 8 residents per year, 2 categorical and 6 advanced. Jake and I both did the advanced program, but we know pretty well the people have gone through the categorical, so we can speak somewhat to that if we have questions. And then as far as fellowships here by itself, we have a PEDS rehab, there's a brain injury fellowship, there's a sports med here in Rochester as well as up in the cities. There's another sports medicine. And then the pain residency or the fellowship is actually done through anesthesia, but there's 5 spots there. And then there's also the pain fellowship down in Florida and the pain fellowship down in Arizona at the other satellite campuses that are mentioned here below. Additionally, we have the opportunity to rotate at all of these areas, Florida, Arizona, and the square at month intervals throughout our training. And the Mayo Health System, kind of the cool thing about that is that we do have pretty good moonlighting opportunities, and both Jacob and I can speak to that. And then we also have a very large active department, over 40 consultants. So it's pretty large, and these are pretty renowned experts in their field. As far as the schedule, we have 13 4-week blocks per year. I would say the first and the last year of your advanced program is kind of dominated with the inpatient. You have 6.5 blocks of PGY2, and then you have, which I think is a huge advantage of this program, is you do 5 blocks of outpatient in your PGY2, which helps you kind of differentiate if you want to specialize into a fellowship or not. You also get some research time. And then PGY3, you get to do a lot of EMG and a lot of outpatient. That's kind of your time to really hone your procedural skills and your knowledge there. PGY4, you get to senior on the inpatient unit, as well as do a lot of outpatient time to prepare. If you go straight into work, you can prepare, and if you go into fellowship, you can kind of fine tune to get ready for fellowship. You get to do a continuity clinic, which they allowed you a lot of autonomy there. It's actually a lot of fun. We just started it, obviously, this year as PGY3s, and it's fun to kind of run it your way and take care of patients the way you want. And then also one of those days that is normally continuity clinic is the research time. So once again, dedicated research, dedicated education time. As far as the rotation specifics, you can read through this, on your time, but very briefly, it has everything you could ever want, I think, from a PM&R standpoint. You got your brain, spinal cord, cancer, PEDS, EMG, which EMG is 6 months. 6 months of EMG dedicated in a row. You get very good at EMG. You got some neurology, amputee, hand clinic is something unique to Mayo, and I just got off that. It was a blast. Consults, you get outpatient PEDS, research, neuro rehab, and then lots of ultrasound and your MSK month, your sports month, MSK clinic month, as well as during your pain. You got a lot of ultrasound, a lot of procedures going on there. And then you also got the spine center, as well as, once again, your pain, where you get a lot of pain procedures there. Let's see, and then call. One of the great benefits is we get home call here. So your PGY2, you have to deal with 13 weekends. It's not too bad. Everything is pretty self-explanatory on the call days. And then also our seniors were amazing, and anytime you needed help, you were able to call them, and if you needed to, you could call the consultant. And then it really starts to kind of sparse down from there at PGY3 and PGY4 year, where really only working between 2 and 4 weekends in your PGY3 and PGY4 each. And then is that 10? Is that up to you, Jacob?
Yeah, I can get started here. So one of the big things that we hone on and we talked about already a little bit is our dedication to learning and education. Tons of great grand rounds presentations, and we get a chance to present some cases as well as some research. We did a literature review this year for all the PGY2s. Wednesday afternoon didactics is fantastic because, as Carson mentioned, the consultants pull your pagers. So there is no distractions. There's no stepping out to answer or deal with anything. That is your dedicated 3 hours every Wednesday afternoon to participate in our ultrasound course, the anatomy courses, or the fantastic board review preps that our consultants put on. In addition, there's always sports medicine, case conference, pain didactics. So there's plenty of stuff throughout the week for us to join based on your interests and what you want to learn about. We have monthly journal clubs, and the consultants also offer up their houses to host, which is great because there's always a lot of food there. Tons of educational opportunities throughout your EMG rotation. And one of the big things that we highlight here is our sports coverage. We have a lot of high school coverage, semi-professional sports coverage. I did hockey last year, and it's really cool to kind of be standing right with the players near the ice, which is a great experience and gets you that personal experience if you're interested in sports. We'll go to the next slide. And as we talked about, you go through several courses throughout those didactic learning opportunities so that you can familiarize yourself with different things. We learn all about the process of doing research start to finish. We go through a gross anatomy course where we have a dedicated cadaver, and we get to dissect certain areas, learn about the different muscle planes and kind of what we're going to be ultrasounding and performing procedures on. We master our physical exam skills, ultrasound skills, and we'll show you in a little bit kind of the staggering amount of procedures that we get to do when we look at the numbers, but we really pride ourselves on the expertise of our consultants and the ability for us to get such a wide breadth of procedural experience. Recently, things that have been added, and Carson can be a big proponent of talking on this if anyone's got questions, is the lifestyle medicine track. Big proponent of healthy living, general well-being, and that's one of the biggest things in medicine that we can pride ourselves on as well. So speaking on that, so these are some numbers that we took from our program from the 2022 class. On the left, you see the national average in terms of procedures performed. And then on the right is our 2022 class that we were able to record for our residents. So as you compare the numbers, you can see that there's just an extensive amount of weight put on procedural expertise and those skills that you're honing not only during the didactic sessions but with patients as well. We definitely emphasize those ultrasound skills, peripheral joint injections, as we have multiples of the compared to the national average, but certainly don't shy away from spine injections and our EMG numbers as well. Spasticity can certainly vary depending on what rotation you're on. I personally had like 65 of those Botox injections, so a little bit more than maybe what this class averaged, but we get plenty of those throughout as well. And even in your third year, you're acting almost as a senior for the second years, kind of guiding them through those procedures as well.
Yeah, I'll just chime in there. There was some feedback to our program about the number of Botox procedures, and they made some changes. And like Jacob said, I'm also in the 60 to 70 range already, just from the being here for 1 year, and I expect that will continue to climb. So they heard the feedback and made the changes.
One of the highlights that we learned about during our time here thus far and are excited about going forward is the very generous conference and travel policy. So during your residency, 3 times you're able to travel just for a case presentation to any conference essentially that you get accepted to. Additionally, there's 1 trip throughout residency that you can go to without presenting anything. So our 4th year residents are all actually getting ready to go to Puerto Rico for that attendance trip, kind of using it as a little bit of a senior retreat, learning about the conference, but also spending time as a class before they all graduate, which is fabulous. And then, of course, a significant amount of time that you can spend away for presenting original research. Very generous budget. I have done a trip already, and I'm getting ready to do another one. $2,000 or more for your travel, flights, hotel, all paid for, includes any sort of Ubers or anything that you need to take while you're there. And then they cover 75 days for your food and things like that. So very common for us to bring our families or our spouses to enjoy the nice areas that we get to go to while we're presenting on conferences. And then again, Mayo is just one big giant center of support. So when we need help formatting our posters, getting the images, making things look nice, we have a media support center that helps us out with all of that. And there's tons of research mentorship throughout the department and throughout the hospital. Looking back at the last several years of what our residents have done after training, a lot of them do go into fellowships, certainly not shy away from just going into straight practice as well. As you can see, 2018, we had half and half, and we usually have a few every year that go straight into practice, whether academic or private. Last couple of years, pretty big on the fellowships. And if you go to the next slide, Carson, this was our most recent graduating class. Very impressive match. All 8 did match into their top fellowships, 4 of which were in sports. A couple are staying around in Minnesota, which we're excited about. Some decided that they wanted to go to some warmer climates. So they went to Napa Valley in Florida. A couple of our guys also went to the Mayo Clinic Jacksonville Center for Pain Medicine. We have a brain injury fellow that stayed with us here, which is super exciting, and then neuromuscular. So you can see a wide array, good variety and spread throughout fellowships, just I think pinpoints and talks to the breadth of experience that you get here and the real emphasis on nurturing whatever you're interested in. All of these people got the experience they wanted and could match into their competitive fellowships. One of my favorite things is talking about wellness and social activities. So in terms of the perks at the top here, we highlight our employee-only gym. It's got all of the equipment you could ever need. It's got the massage chairs. It's got the saunas, the swimming pool, $25 a month, very reasonable. Tons of social and well-being committees to emphasize us getting together in and out of the hospital. We just recently had our summer golf outing and a big department picnic, which was super fun. And then there's a bunch of resources for spouses or families of trainees, including helping with job placements for spouses. Great time off that's allotted for any appointments that you need. Moonlighting is very available and easy to get, as Carson touched on earlier. And then in general, for a Midwestern town, very low cost of living, minimal to no traffic, and plenty of vacation time.
We are the county reigning kickball champions two seasons in a row, so there's that.
And then touching a little bit more on kind of the low cost of living, I think for what we pay for rent and utilities and groceries, we get paid a very fair salary as residents in a Midwestern town. And in addition to the raises we get from going to each PGY year, we also, throughout the Mayo system, got a 6 or 7% raise in January. So 2 raises in the last 6 months is pretty nice, and it goes a long way. I personally live in a rental house, 3-bed, 2-bath for just under $1,750 a month. I know people who have very affordable apartments right next to the hospital too, so plenty of options out there. So next few slides are just to highlight some life outside of work. Minnesota is known for its beautiful nature, both during the winter and the summer. Plenty of state parks within driving range of city limits and short drives away. Also, Rochester, as a town that gets a lot of snow, usually uses their time well in the summer. So on the bottom here, I highlighted one of our biggest events, Thursdays on First. Every Thursday, they shut down the main street downtown. Tons of live music, food and drink vendors. Really great time right outside the hospital to get together with friends when you're off work. And then the bottom right was a place I just visited. That's Willow River State Park, just about 45 minutes or an hour north. Tons of waterfalls and amazing parks just within 30 to 40-minute drives. Great camping sites too. And then these next couple are just our residents having fun outside of work. So as Carson mentioned, we're big with the intramurals. We play volleyball up in the top left, pickleball. We are the reigning kickball champions, as we mentioned. So we're super excited to three-peat up in the fall. We organized a poker night at my house a couple months ago, and there's actually another one coming up next Saturday. So everybody loves doing that. And then as Carson mentioned, we get together for some of the semi-professional sports games, and you see that up on the right there. Couple other things that we do together. The left picture shows our house crawl last year. A couple of our residents live within the same neighborhood, so really gives us an excuse to hang out and have fun. We really do genuinely enjoy spending time with each other. It's a big active group, and we love spending time both in and out of the hospital. We even brought our dogs to the last baseball game for pup night at the park, and then that bottom picture is from our golf outing, so you can tell we're having a good time. So that's really all we had for you. Just a brief snippet of what we have to offer here at Mayo Clinic. Like I said, I'm Jacob and Carson was here joining me. Both of our info is up there if you want to snap a picture or write that down. We're more than happy to answer any and all questions about the program, about Rochester and living in Minnesota, about the intern year. We can certainly get you in touch with our fellow residents who did the intern year here if you're looking for more detailed information. Would definitely recommend following our social media pages to see what we're up to on a regular basis and how we have fun both in and out of the hospital. And I think that's it. And we left some time for questions. If you guys want to drop anything in the chat, I'll hang around for a few more minutes to help answer those. But that was pretty much all we had for you. And I see some questions coming in, so I'll jot those while the next presenters get ready. Carson, do you want to hit the lifestyle medicine track?
Yeah, so lifestyle medicine track, we do a monthly session on Zoom or in person, depending on where you're at, which hospital, side of the hospital you're at. And we meet together, we talk about what we did the past month. We follow the American College of Lifestyle Medicine residency curriculum, and we work together on the kind of getting your project hours as well. So like I have a little handout that I talk to my patients about often and try to include that in my continuity clinic as well. And we have some very good proponents in the faculty that have been pushing lifestyle medicine. And then I see, hopefully that answers your question, Luke. I see Lisette Caldera expanding on the research within the program. That can be both whatever you kind of push for. So like I was with a consultant and I had to like, hey, what about this? And she's like, let's do a research project on it. So now Jacob and I are doing a systematic review on like thoracic radiculopathies. And then also if you say like, hey, I want to go into sports and can I talk to someone about sports research? And then they'll be like, hey, here's 3 projects. And you're like, oh, I can only do 1. Or you can do 3 and you do a lot. As far as like a mentor, you do have research mentors that you can talk to. But generally, like you just ask any of the consultants and they have like 3 or 4 programs that are 3 or 4 research things that they're working on. You can just do it that way. I don't know if you have anything to add, Jacob.
Yeah, I'm just typing away answering Munib's questions, but no, I think research is very available. You are paired up with a mentor, and you're also paired up with another resident mentor who's older than you as well. So lots of experience and people to lean on for support. As Carson mentioned, we've got a couple nice things going on right now. There's also quality improvement. So a lot of research. I think overall, if you're interested in research, it's going to be there. It's not like something that you have to look for, that's for sure. And you'll probably end up be turning down projects because there's just a ton going on and there's always room for more help. Any other last minute burning questions?
All right, thank you guys so much. If you're okay with it, feel free to share your contact info. People can ask questions outside of here. Really appreciate your time tonight.